Okay,
Right there, Mr. Luke.
call meeting to order here. Whatever the date is, what is the date? And I'll take an approval for the
I
agenda.
move to approve the agenda as presented.
Oh, and we have an amendment to the agenda. And John, you can approve with this amendment. We're going to take number 9, Community Service Division update. We're going to move that update down to right before adjourn. So it'll be.
As presented with the changes.
Second. All in favor?
Aye.
Thank you. Okay. Approval of the minutes from the March 12th meeting. Take a motion of approval.
Move to approve. I'll second it.
Rita, okay. Thank you. And we have public comment. Anybody anywhere? All right, no public comment. Receipt of information from supervisors not seated as committee member. We have an update. Go on division strategic plan, number 6.
Okay, so Claire and I are going to do in tandem so we can make sure that our online people can see what we're talking about. So I've got my thing. I'm going to go right to the CSD planner, Claire. So we do a strategic plan every 3 years. It's updated. Back.
No source detected.
Hey, that's what I get at my house. Whenever I plug my
iPhone in. That's a philosophical.
The strategic plan, right?
there.
have some esoteric there.
See, that's what I'm talking about.
Thank you,
Simple
Claire.
things.
Okay, so when that plan fails, we go to this plan.
Turn it off, turn it off.
We're resilient, so. Okay, this is my screen. All right, so every 3 years we update our strategic plan. We will be working on updating it again. So we're just at the tail end of our strategic plan, I believe. So is it 25 that we redo? Yep. Okay, so back a few years ago, well, about 6 years ago, we had help with UW Extension. Don was in his role at that time when we created a different strategic plan that included the entire division. So previously, for public health and accreditation, they were required to have a strategic plan. And we kind of muddled along the reorganization of community services and developing something that was all inclusive of all of the departments. So with Don's help, we developed a division-wide strategic plan. So the 3 areas, so it's based on the lean model. I think we've talked about this before. So we touch on 3 key areas of goals that we want to meet. People and culture, process and systems, and purpose. So within that, that's how we categorize all of the goals that we have in our strategic plan. So you can see the top one here, possible deliverables, building trust across community services division. We chose that because through our engagement survey, we scored maybe not as high as we wanted to on the trust factor. So that became one of the areas that we wanted to work on. Process and systems. We want to meet the objectives of what the accounting board is telling us. So there are goals within that bucket. Technical improvements across CSD. We're always looking for efficiencies, and technology is one of those areas where we can make improvements. Most recently, like our electronic health record, we switched that up, and the jury is still out on how efficient that is, but we'll get there. So purpose and product, provider network, because this is like a service desert up here in the region. So like developing resources for the services that the public we serve need. And then the partnerships, developing our partnerships out in the communities. So those are the possible deliverables. Current deliverables, we're working on inclusive culture, improving our communication. I think that could be a goal forever, because you can always improve your communication. increasing our employee retention. So we're doing some activities around onboarding, recognition, appreciation, load balancing work, that type of stuff. Building trust. So as I talked about the trust before, building trust across CSD. So from all angles. And then becoming a trauma responsive agency. So these are the main things that we're working on. And then within that, we go down to each department. So when Lisa works strategic plan, they have their inclusive culture. So you can see here, keeping it alive. They implemented accountability partners, staff receiving quarterly reflect forward, holding behavioral health team meetings. And so they work those goals within each of those departments, developing the provider network. So you can see employee retention. So they all work on the same thing, and it all rolls up to the bigger picture. So and they can have add-ons too. If they're finding that there's something within one of those buckets that they really want to work on and improve, then that they can do that. We make sure that we carve out time to be able to have staff, because we built this from the ground up. Our staff were involved in through the engagement survey, and when we are setting the goals, and all staff have access to this channel in Teams, so anybody can go in there and take a look and see what we're doing. And I think the managers assign tasks out to the line staff to make sure that they are being engaged and involved in this process. So like for business and operations, well, it's business services now. They changed the name with the wage study, streamlining our processes. There's lots of redundancy we're finding in the work that the support services do. So they're working on storage spaces, it looks like, fiscal workflows, improving communication, key partnerships, doing some work in the records room, looking at the CSD onboarding, offboarding process. And then she's doing some monthly one-on-one meetings for that trust piece. Employee retention, so looking at training checklists, team activities, sharing of data, shared leadership. So that was one of the concepts that came out of our work with ECHO, and really empowering our staff to take a hand and some responsibility in the shared leadership model rather than relying on the leaders to do all of the work. And that's gone well. I know Diana's done that in her unit too, and it's gone really well. So children and families, I'm not sure. Is there anything, Lee, that you guys are working on that's, yeah, so teaming with children and families for out-of-home care. We're going to talk about that a little later. That's a big one for us. Relative caregiver searches, onboarding, super important. We've really done a lot of focus on onboarding staff. The YAZI policy procedure, that's a youth justice initiative that the state rolled out, quite a few years ago. We were one of the pilot counties that for the implementation. And now I think we are one of the subject matter experts that others counties in the state utilize us for when they are rolling out their YAZI. It's youth
Assessment Screening Instrument.
Youth assessment screening instrument. It gauges the level of risk that the youth has once they potentially come into our services. So they
And also their strengths protect.
Okay. Trauma responsive. You see a lot of talk on trauma responsive, and then develop a full-time FTE structure. Is that full-time employee structure for DCF that meets Wisconsin standards and business needs? Using our professional development resources, making sure we're trained up, able to do our jobs, managing our open positions, and it goes on and on. So if anybody wants to like dig deep into this, we can dig super deep. I'll just highlight economic support. They do a really good job of working this plan. I'm going to go over here. So inclusive culture. So like, for example, Diana's doing a monthly video at her staff meeting. We're doing the Reflect Forward module. So that's the inclusive culture framework that we had come in last year and teach us. We're keeping that going by these Reflect Forward modules. So it's nothing that the staff haven't been taught already. It's just keeping it fresh in their minds. She does a shared leadership model. So she's got all of her staff taking a turn at facilitating meetings, coming up with the topics, coming up with the presentations. And it's gone well, right? They really, really like it. They do their one-on-ones quarterly, managing the consortium data. So in addition to all the work that they're doing within CSD, they have the consortium that they are also responsible to. Customer service, always looking at providing the best customer service. Department and partnering agency collaboration to best serve the customer. So they do a lot of crossover. They attend meetings, do some learning back and forth on what the departments are doing so that we know that people touch most of our departments many times. So we're trying to streamline that so we can provide a really streamlined service delivery for our populations. And then worksite wellness. So doing some self-care stuff. And public health. So it looks like the trust piece is in public health, creating policies and standard operating procedures. That's a big one. Improving communication. Like I said, you can have that on there forever. Maintaining 2 representatives on the trauma responsive work group. They've now changed their name up a little bit, so we can maybe bring that to a committee meeting later this year. They complete their trauma videos monthly at their all staff meeting. And then they are encouraging self-care practices. So with that, any questions on how we are meeting our strategic plan? Denise?
Great. So you're taking the county goals, you're rolling them down to the department. Then the divisions have their goals that also support the department. And so Diane, are you pushing them like all the way down to the individual levels?
Yep.
When you're doing these one-on-ones, are there?
Yeah, so we do a lot
What
of,
performance packet do you use to communicate all of your?
we do a lot of goal setting. Well, I think we all do a lot of
Yep.
goal setting, and that's what we talk about.
So
one-on-ones and
so we roll up to the priorities. I think everything that we do can fit in the top 2 buckets for
Cascade
the most
back.
part.
Right.
But then we also had done extensive work on the mission, vision, and values we brought to you guys. So we tie everything back to those values and how we're doing business. So when they're having those discussions in those quarterly or monthly meetings, they're talking about how are you meeting those values? And this is what I saw you doing. So, just really embedding that into our culture.
And are you, so I'm just thinking about part of that retention, and goal setting and the monthly pulses. Are you delivering meets expectations in the end of year expectations or an exceeds expectations? Are you doing a numerical value for these goal sets?
So the county.
At the
is in the
measure,
process.
yeah, at the at the lowest levels that roll all the way up.
Yeah, so the county is in the process of revamping the performance evaluation system. I think we'll have a little more information in 2025. But as far as so we're putting our values and those objectives into the performance evaluations when we're completing those. We're actually in our window right now for completing performance evaluations. So that is all being tied back.
So is that annual performance? Okay, so, sorry, having a rough day today with words. So as an employee, okay, Diane and I are sitting down. She's going through my performance as it pertains to the goals that we have set together. And I walk out of there. Am I going to know no surprises at the end of the year when I get mine.
There shouldn't be.
There's gonna be either like a numerical value, like I gotta hit 1,000 and I'm at 700 and it's 2 months in. I'm obviously like,
So we meet,
good enough.
we have the quarterly check-in is to check in to see if, how they're doing with those performance management goals. We're not rating them yet,
Right,
but that's for the countywide. We're waiting for the countywide process to roll out.
right. But,
And I
but,
think-
but they're measurable. Are they
Yeah,
measurable?
they're measuring.
All right, okay.
And I think, while our requirement is quarterly one-on-ones or check-ins that we have, many of us do them more frequently, especially with folks who may be struggling in an area here or there. We have the 60% of staff time is expected to be face-to-face. So spending time with consumers or doing consumer-based work. And so when we have folks that might be falling underneath that, that's opportunity for us to talk about that at those one-on-ones as well.
Perfect. This is great stuff moving towards.
Way to go.
Yeah, this is like what they do in the corporate world, that one of the things I liked about the corporate world.
So just to follow up with her, so when you do a performance plan, what is your improvement plan based on? So if you have somebody that's not meeting those expectations, so what are you basing that improvement plan on?
What I do is I expect staff to create their goals are always a personal goal, a professional development goal, and then sort of a work-related goal. And so they use SMART goals. I don't know if they're not familiar with SMART goals, but that's my expectation of them. And I think we use those check-ins to really keep a pulse on where they're at with numbers, and that kind of thing. Or if there's, maybe their documentation isn't as timely as we would like it to be, and we're seeing that on a regular basis. But one of the things I'll talk about later is we're developing behavioral health, a quality assurance QI process to kind of look even more closely at that meeting date deadlines and those kinds of things. So I think that will kind of feed into there as well. It
Are you,
makes sense.
are you asking if they're not meeting a benchmark
Well,
like
as
the
part of that,
60%?
that's the follow-up.
So we could do performance improvement plans.
Yes.
Haven't had to do that for a long time, but yes, we can do that. And we do that hand in hand with Sonia and HR, of course.
I think what we're doing is looking at what are the barriers before we get to that
Oh,
point.
absolutely.
Right.
So we're coaching with them to remove all barriers and taking it progressively. We don't want to get to a performance improvement plan, but sometimes you have to.
Correct.
So really, yeah.
Just as a quick note, knowing Don and how efficient he is, when you set up a strategic plan, you have boilerplate items that are in a strategic plan. So the reason that I'm asking that is if you have performance goals that are set and objectives that they have to meet as an employee, that's part of the overall strategic plan that goes basically across every department.
Well, so for example, the client service hours expectation, that has been a work in progress for us. I think people are getting to the point of acceptance with it. So we haven't put it into our strategic plan as one of those goals that every staff will meet that 60%. It's a little bit different. For example, so the client service hours is like direct client time. Public health is more prevention work and grant work. So we have to maybe tweak it a little bit.
I understand. But as long as there's a consistency for each department so that those individuals that work there can't look at somebody else and say, why are you doing it different over here when I'm expected to meet?
Yeah, we have that.
We have that.
That's
We
normal.
have that.
And I think what we found in implementing this is it's not a common practice across the state.
No,
There are
and
few counties that have
Right.
productivity, if you will, or consumer service expectations. And so that has been one of our challenges is our number accurate? Is this is it
Right.
the true expectation? So it's kind of a moving target for us. I think,
And I
we try
think that
to review that.
every time that you set up an evaluation plan that has to be subjective, there are objectives that are there, but
Yeah.
for each department, that there are going to be some subjectivity that's going to be in there.
Yeah, like,
And I understand.
Well, that's why you get good buy-in, right?
Right.
And when things are subjective, my advice that you can drive that objectivity by letting them tell you what what they feel it is, right? And when I say them, I mean whoever has that particular goal. And then if you buy into that,
Right, and for like ES, because we're part of a consortium, we have our strategic plan that's for our division, but then we have a whole nother layer where staff, then we have our guidelines and standards that have to be met for the consortium. So you have to figure out how they intertwine them. And for us, we have monthly scorecards from the state that tell us each staff member how they're doing in our call center. And for my team, we are very transparent for that. So like all 11 of my staff can see each other's scorecards. And so it really becomes, how come she's performing at this? Why am I down here? How can I be like that? So that it really builds that collaboration within the team, that they can be that transparent and really work towards a common goal to provide the best service to our consumers. So,
Not all departments are on that level.
right.
Not yet.
But it
Yes,
really
it
works
sounds
well
like
to
you guys
help
are-
with all of everything that we are doing with that strategic plan, where it comes with trust and all of that stuff, really builds all of that. To have
So-
to be that transparent.
In DCF, we also, the state gives us benchmarks too, that we have to meet like 90% of face-to-face visits for children out of home. We're gonna get access reports in timely, and the benchmarks are like 90 to 95%. And that's part of our strategic plan as well. And we get a monthly report from the state on how Polk County is doing.
okay. One last question, Don. From what I'm hearing, I'm thinking that this is working pretty good. What about, are you the gatekeeper for the other divisions and departments?
I think that's a good question. I would say that across the various divisions, there's not a common planning framework. That could be an objective for the administrator and the divisions. But at this point, I would say there's various levels of strategic planning within the divisions, and CSD, for a number of reasons, has been far ahead of some of the others. So that's something to be proud of, I think, for this committee
Yeah,
and for CSD.
And that's kind of what I'm getting at. That's kind of what I'm getting at here is, you gotta blow that horn. You know, I mean, I think that, those type of, I mean, if you're the gold standard and nobody knows about it, what does that do for morale is what I'm thinking. You know, and then your retention of your people, like, we're doing so great over here and it doesn't feel like everybody else is doing up to this extent and level, you know? I mean, this Yazzie thing, how come this is the first time I'm hearing about it?
I think it's
Get
different.
with Claire and broadcast the heck out of that. If we're the best, let's tell people about it, because the work that we do in this board right here is kind of thankless. I know you guys feel it. You have to. I was a safety lady and in the military for 42 years, okay? I can tell you all about thankless jobs, all right? And morale. So I think, as I leave here, I think you guys, we need to broadcast this kind of stuff. Whether it's pulling you supervisors in to train the others on how to do stuff. Anyway, that's all I got. Sorry.
Did you have a question, Rita?
Well, I did. I just want to say, when I heard you saying there's some measurable things there, there's like, more objective rather than just, yeah, you're doing great. I'm meeting that. It sounded like you have objective parameters, which is, then the employee can sign in. And if they're not meeting it, it's not because you don't like them. It's just, an objective measure.
As a department head, we have full staff.
Let's see, what do we have? Two openings, I think.
That's amazing.
Three openings,
Did you close the speech path?
3 openings out of about 90.
With our new pay framework, you have applications.
Yep, we are seeing an increase in
Interesting.
applicants. We are seeing an increase.
Two-part question then. How's our state funding, state and federal funding? Are you fighting for some things that we need to be contacting our legislatures or?
Yes, we had for the crisis beds. in the area. I know a lot of committee members had reached out to representatives. If you would like to do that, I've got some language for
That's what
you.
we needed.
Yep.
The only thing that they listen to really is, you can preach all day as a department head, but when they get some personal contact
Yep.
with individuals, they listen.
Mhm.
Where are we at and on the caseworkers? Are we full staff on caseworkers? Are they overloaded or doing overtime?
They're not doing overtime, only, I mean, sometimes it's unavoidable for those positions that are on call. But I believe, was it one or two positions? Commission work that we're recruiting for? Yep. We've been pretty lucky in that area. We started doing, more of an open recruitment, and we interview a lot for smaller numbers of positions. So we create eligibility lists. So if we do have a resignation, we can pull right from our eligibility
How
list.
many
because-
caseworkers do we have right now? 3?
I would say it's almost half of our staff.
How many openings do we have for case
How
or?
many total
How
social
many
workers?
active caseworkers do we have? Well, they were also overloaded that.
I have 14 in my unit. I think I have close to 20.
These caseworkers are still the toughest job. Some of the traumas that they go through.
Mhm.
I always worry about their safety in some of these home visits and there's times I think when we should have some protection from some deputies or
If
something.
they want to give us badges and guns, we'll go out there. We do call badges and guns when we need to. And we are bringing some field and building safety training this fall, provided by law enforcement to all of our staff because they've been asking for it. There's, like it or not, there's dangers in this building too.
Yeah.
There's dangers out in the field, so we want to get some training on keeping themselves safe in any situation.
Safety to me is number one. Guns and Roses situation.
And Guns N' Roses, yeah.
Any other questions on this topic?
I just have a quick comment. I used to do strategic planning for a living for about 12 years, and you're doing all the right things of like keeping it alive is the hardest thing because they're usually like doorstops and dust gatherers. So kudos to you for having systems and continued conversations about this all the time because otherwise it's very it's very unmotivating to be even asked the questions. You know, we did so many eye rolls, people's eyes were falling out of their heads. Like, yeah, we did strategic planning 18 times and nothing happened. So kudos
We've
to
heard that before too.
Yeah, I know you probably have, and that's
Yeah.
probably why you got here. So anyway, I just
Doing it.
really good use of technology as well. Because when I was doing I didn't have any of that stuff.
Paper and pen, right?
Stone tablet. Or spreadsheets.
Okay, are we done on this topic?
I think so, unless you want to go right into the weeds.
No, we're good. I mean, I'll go if somebody else wants.
Or should I just unhook this?
Okay, so our next topic is from Andy. We're gonna get an update on the Veteran Services Office. Thank you, Tanya.
All right, good morning. So I just have a few BA updates. Recently, we had a handicap door opener installed on our main suite, so glad to have that. We had some grant funds available that we used to have that installed, so now we don't have to worry about veterans getting knocked out over if they're coming through with walker, things like that. So we're pretty happy to have that. On March 5th, VA, they made a huge change again for VA healthcare eligibility. They essentially opened up the door for all veterans who were exposed to any type of toxic chemical. They are now eligible for VA healthcare. Their plan was to implement that in, I think, over 5 or 10 years, but for whatever reason, they pulled the trigger on it, and 3/5 is when it happened. My concerns, I think there could potentially be issues with quality of care at VA because if you have hundreds of thousands of new veterans being put into the VA healthcare system in a short amount of time, and if VA doesn't have the staff or the capacity or the facilities to serve or treat all those veterans, I'm concerned with, waiting lists and things like that. So I'll keep an eye on that. Hopefully that doesn't happen, but in general, I think all veterans are happy overall with their quality of care currently at VA. Another VA update with healthcare is that the Department of Veteran Affairs is now doing the Inspire device implant. So for veterans who suffer from sleep apnea, and if they can't tolerate a CPAP or a dental appliance, they're now able to get the Inspire device implanted. Pretty neat. You just hit a button at night, I think, and it has some type of a nerve stimulator that goes up into your jaw or your tongue somewhere, and that's supposed to keep your tongue flat. So I know there's a lot of veterans out there that can't tolerate CPAPs and, dental appliances and things like that. So for them to be able to get their sleep apnea treated, obviously it will be cost saving because everybody knows all the other health risk and illnesses associated with sleep apnea. So glad to see that go through. I think they implemented that out in Tennessee, and I believe VA is just kind of working on distributing that out to the different healthcare facilities. Disability compensation. So last calendar year, 2023, Polk County veterans that I assisted with compensation claims were awarded $867,000. So that's retro payments. Those are claims that were submitted and then granted by VA. I think our largest one total was right around $240,000 for one veteran. So pretty remarkable. For retro payments so far this year, we're at $184,642. So it's a good amount of money that, veterans are being compensated, and that's just a retro payment. I feel, or I would have to imagine a lot of that money goes back into Polk County and things like that. So pretty excited to see high numbers like that. I don't know what they've been over the years because I'm just now kind of trying to track this and figure out kind of like an average and things like that. But I think it's pretty interesting. So that's all I really have. Yes.
Are you what category of veteran are you finding? Are you finding like a Vietnam era or Gulf War or?
That we're serving here?
Yeah,
Yeah, so,
makes sense.
yeah, I would say the majority are still primarily Vietnam era. We're starting to see more of the Gulf War, Desert Storm, and post 9/11 veterans. And a lot of it is just awareness.
And there's a latency period too,
Yep.
30, 40 years, so, okay.
And veterans can be prideful. I've heard so many stories of Vietnam veterans when they came home from Vietnam, they went to the VA and they were basically turned away and told them that, essentially you're not welcome here. That's how some of them took it as. And they've never gone back because they don't want to experience that same situation again from the
Tremendous.
VA. So.
Is there dental care available to veterans and their?
In order for a veteran to be eligible for dental care through VA, they either have to be 100% service-connected disabled or have like an in-service dental condition or trauma. Like, say if like a veteran was involved in a blast and they, took some shrapnel to the jaw and they have teeth missing or things like that, VA would cover those damaged teeth or that damaged area.
So it's pretty scarce.
It is.
How do you determine, like Jay, how do you determine when they have trauma, whether they go to St. Cloud or Minneapolis?
As far as dental?
No, it's like Jay goes.
As far
went to St. Cloud last week, and
yes.
I think you do both, don't you, Jay?
Well, they're so efficient nowadays that, you have a choice, basically. I can go to the main server in St. Cloud, go to Minneapolis, I can go to Amory, by choice, due to the fact that the distance that we live within. And it's not that restrictive either, 50 miles or less, and, you're just covered. I remember back in the early days, 60s and stuff, when you got out of the service, you had two opportunities to give your life for your country. One was at the battlefield, and the other at the VA hospital.
Oh,
I tell you, times have made a complete turnaround. It's unbelievable what you people are doing. And the VA, they're so accommodating that it's hard to explain. I mean, it's medical service to the nth degree, I go to St. Croix Falls, Amory for various different, if you want an X-ray, or Regions in St. Paul. You go pretty much wherever you want.
Yeah, so it's going back to your question, it's veteran, it can be veteran preference. And then as far as with Jay talking about Amory or St. Croix, the Department of Veteran Affairs has a program called community care. So veterans who are, beyond 50 miles drive time from a VA facility, or if like a specialty care clinic, if they can't get in to see a specialty care doctor within 30 calendar days, the VA can send a referral to that non-VA facility such as Amory, St. Croix, basically anything. And then that veteran would go and get that care locally in the community. And then that facility would bill VA for that care.
That's huge progress in their policy.
Oh, absolutely. Yep.
Unbelievable.
The only drawback is there's more, you have to jump through a few hoops to make sure that it's authorized through VA. Because if it's not, then VA doesn't have to pay for that care.
we've experienced that in behavioral health,
With, like,
VA for our services. It is a lot of hoops to jump through, but once it's all set up, it's good to go, but it takes time.
as far as like getting the authorizations
Yep.
and things like that.
And Lisa, do you guys help with those authorizations at all, or is that?
Oh, yeah. As much as we need to, our intake staff will be in communication with the VA
Good.
office, and Andy's helped us out.
Good, okay.
So
Ryan?
we tap into.
I just asked for the Inspire device. Did you say that that's available like widespread now, or?
So VA, it's in the works of being widespread. I don't know what it is outside of the VA.
Well, I'm
Network?
sorry for the personal question.
No, it's okay.
My dad is a Vietnam vet and has been waiting on word for something like that.
Yeah, so I think it's been approved by FDA. VA has started doing it. There's certain criteria. I think their BMI has to be below 40. Other than that, if they've struggled with tolerance of the CPAP, tried to exhausted all other type of care, he should be eligible for that. I would say have him call the Minneapolis VA sleep clinic and get set up for an appointment for the Inspire device.
Thank you.
Mhm.
You can do it at home.
The sleep studies, yes, yep.
Just have to have it set up.
Right,
Thanks for your service, folks.
yeah, thank you.
Thank you.
Okay, anybody else? Last one? Thank you, Andy.
Thanks.
Okay, who's doing this next one? Is that you? So, update regarding placements. Oh, Leah.
Aliyah.
Okay, so we wanted to get in front of you guys sooner than later, just to discuss what's happening with some of our placements, mostly in the Department of Children and Families. So I'm gonna turn it over to Lee to talk about some of the types of kiddos that we're seeing come through the doors, and then we will talk about the impacts of that financially on our budgets.
So currently in Department of Children and Families, which includes Child Protection and Youth Justice, we have 19 kiddos in placement. Of those 19 kids, 10 of them are placed in like less restrictive, I guess is the word I should use. So they're placed with family members, non-relatives, or in foster care. Of those, of the 19, 9 of them, we are considering high acuity kids. So these are the kids with those high behavior needs. They're a danger to themselves, to others, or the community. And they're placed in some pretty high buck placements, and Tiny's going to talk more about the numbers for that. But the behaviors the challenges that we see, the charges that they're facing, battery, physical violence, sexual assault, incest, running away, stealing cars, setting fires. We're seeing more animal abuse, strangulation, suffocation. So these are some kiddos with some really high needs. Of those 9 kids, of our 9 high acuity kids, 6 of them, I think it's worth noting, are special needs adoptions. So what that tells me is that they've experienced that complex trauma at an early age, right? From like 0 to 4, and how trauma affects the body and the brain and development and all of that. So we're working on a plan really hard in Department of Children and Families. We have a position open in our youth justice unit right now. We're recruiting for a high acuity case manager, social worker. And this worker is really going to focus on keeping those kiddos in the community, or the ones that are in placement, finding an appropriate placement back into the community. So we really got to start thinking outside of the box for these kids, because we know what's best is for them to live in the communities with their peers and get those skills and form those attachments and connections with other human beings. They do really well in residential because of that attachment and that early onset trauma. They just go there and have those expectations and don't need to make connections. However, that doesn't help as they move on throughout their life. So this position will recruit new homes. We've had some success through a grant that we were awarded with 4 counties the last couple of years. We do currently have a high acuity home in Polk County. And with a high acuity home, there's some certain rules that they have to follow. So not follow, but criteria to become a high acuity home. They have to have a great support system, or it has to be like a 2-parent home. And one of the caregiver has to remain home, be available for appointments, taking the kid to appointments, attending appointments at school, IEP meetings, things like that. A big support system, because they need the support to reach out from their family members. Valid driver's license, being able to become a licensed foster home. And they get a $3,000 a month stipend to become this high acuity home on top of the foster care rate. We are looking to increase that in 2025 to $4,500. We need to recruit more homes because we've had success with our one. We've had 2 youth in there. One youth was reunified back with her family, so that was very successful. The other youth is currently in placement for a short stint, though, for 3 months. And then the high acuity home is working with that placement to integrate them back into the community. This is the highest I've ever seen it. As far as placements, these high acuity kiddos, and I've been doing this work now for 19 years. So I wish I had an explanation as to the why.
Yeah, so to add on to that, there's a shortage in Wisconsin to meet the needs of these kids. So we are placing kids out of state, like we haven't placed them out of state before. I remember maybe 5 years ago, we had our first out of state placement to Tennessee. It was one kid. We ended up getting her back up here and on long-term services. She aged into adult services. Now we've got Tennessee, we've got Minnesota, we've got Ohio. I think those are the 3 out of states that we're doing. So that's a whole other set of hoops to jump through to get an out of state placement, because we have to work with interstate compact, and it's a big deal to place these kids out of state. But because Wisconsin doesn't have facilities to be able to meet the needs in state, we're going across the nation now searching. And I know Hannah had called for some of these kids, 30 to 40 different facilities to try to find placement for them. And they were on waiting lists for these out of state placements. So we are appreciative when they accept one of our kids, but then we're also thinking at that time, how do we get them back? Because we want them back in our community.
Right. And a lot of times we're housing them until they come up on that. We're placing them in a juvenile detention center in a secure placement until we can get them to their out-of-home placement, which has little to no treatment or services.
Yeah.
It's jail for.
They're just housed there.
That's just compounds.
Is the funding for that part of your budget?
Yeah, so for the funding, these are mandated services, so we are obligated to keep these kids safe, along with keeping the community safe. We are severely underfunded with our state grants, our state contracts. Most of it is coming out of levy, to be honest. So of those 9 kids that Lee talked about, that are the ones that are going to be hitting our budget pretty hard. We are looking at Rawhide. That's on the eastern side of the state. There's 2 kids. One's going en route, maybe.
Yep.
Not sure. He's the kid who stayed the night here the other night with us. He's going to Rawhide. There's another one. We're getting 2 for deals now.
We are.
So it's $10,000 a month at Rawhide to keep these kids safe in the community. Youth Villages is the one in Tennessee. That's $18,000 a month for one kid. The Buckeye Ranch is in Ohio. And these places are doing remarkable things with these kids. Well, they're not getting kicked out. So Buckeye Ranch is in Ohio. What is that? $14,000 a month per
Which is
kid.
a working ranch, and the kids there are doing really well.
When they decide that they can't start their own gang.
Right.
Right
After
there,
they got
so-
through the gang issues, yeah.
Are you talking about,
Cowboy gang.
are you talking about juvenile detention placement now or just
This is residential.
residential?
This is true.
So it's not the level of juvenile prison.
How many
Not
kids,
locked.
you know how many kids we have in-state or out-of-state in juvenile
Yep.
detention? That's where our big money is.
Well, we don't have any no kids in juvenile detention.
Well, we currently have a couple kids in juvenile detention waiting residential placement. And compared to treatment or residential, juvenile detention's cheap.
Yeah,
So I think
definitely.
he's talking like Lincoln
Oh, Lincoln, like correction.
corrections. That's what you're talking about, right?
We don't have anybody.
We don't have any. There's very specific criteria to be able to place a kid in corrections, which we would never want to do, but we have come across some kids that probably, depending on how the court order happened, would have been appropriate based on the behaviors that they have.
Thank you.
So then Prentice House, that's up in Superior.
Ashland. It's a group home.
Ashland. That's about 9,000 a month. We've got one kid there. Northwest Passage up in Frederick, those are mostly for the 30-day assessments. I thought those were about 30, are those 30,000 each?
Yeah, they're pretty.
They're about $30,000 for that 30-day. And then the Nexus Mille Lacs is up in northern Minnesota. That's $20,000 for one kid.
And that's the kid that just got kicked out
And he got kicked out, so we have to find a place for him. So
today.
he's not gonna come and stay the night here.
No.
We would not. But yeah, so we need to find a place for that kid. So they're probably calling these other places, look to see if they can squeeze in another one from Polk County. So if you look at our budget today, the line items don't look terrible, but we've only processed 2 months worth of invoices in reality. March invoices are coming in. So for the rest of this year, if our trends stay like this, we're looking at $1.9 to $2 million for these high needs kids only. Keep in mind, we've got all of a slew of other foster care, other types of services that we're paying for. So this is just, these are our kids that are so high need, hard on them, hard on their families, hard on the workers, and hard on the budgets. But we have to do what we have to do. So we'll bring this information to you as much as you want to stay ahead of it, but we don't want anybody being surprised as we roll through the year and these trends continue.
Is that more than double our budget in the last 5 years?
We budget total for all services in DCF, we budget $1.7 million for all of our paid services. That includes these 9 kids, but there's a bunch of other stuff we pay for too.
It might go past that.
I'm predicting that we will go past that.
Your thoughts about why you're seeing more than you've ever seen in your 19 years?
So about 10 years ago, when I was doing juvenile intake and child protection, we were removing kids at a really high rate for neglect. A lot of methamphetamine use, unsafe conditions within the home. So a lot of kids were removed. And as they started keeping track of statistics, the state recently started about 5 to 8 years ago. The kids that are involved in youth justice, 80% of them had involvement in child protection. So to me, without, validating anything, it's trauma. It's how trauma affects the brain and how those parents that are parenting these kids, just don't have the skills.
They don't want to.
I don't know that they don't. Did you say they don't want to?
They do what they know.
Yeah, they do what they
They know.
know.
Just thinking about
But and a lot of these are special needs adoptions, so they're adopting them when they're 5, 6 years old, right? We're not seeing those behaviors. They adopt them. It's when they hit puberty or when they get older. Those behaviors explode and you can't predict the future, and the state has recently come out with, in order to do a special needs adoption, you need more training and things like that. I think there's a long ways to go for support for parents that adopted kids that were special needs. And when I say special needs, I'm talking about developmental delays, but I'm also talking about that behavior special needs.
The trend is that they want to give them back to us. They terminate their rights
right?
when it gets to this level.
Because I'm looking at, can I?
Go ahead.
So I'm looking at the numbers, and I mean, 30% of them are high needs adoptions. So it's quite obvious that there's a root there, right?
Trauma.
And that is not being identified.
Trauma. We would say it's trauma.
Sure.
Yep.
Early
Yeah.
age trauma.
So
Yep, more definitely. And with the way things are going today, and I'm specifically thinking about like the Crumley parents and the school shootings and having those discussions on who is responsible for children and their behavior in company with how do you go at it? How do you fund it? And, I think when they have the gun lobbyists and the Second Amendment people saying taking away guns is the situation, let's throw money at mental health. Well, that's my big question is, where's the mental health initiatives that are coming in that are gonna help address these behavioral issues at this level right here? Because we're getting close to the root. We're right at, we hit the root right here, as far as I'm concerned.
And I will say that the big picture for most of these kids is we kept them in the community for close to a year to 2 years through CCS services and behavioral health, through parent education. I mean, but they were hanging on by a string, you know what I mean? But we were able to maintain them in the community probably longer than we ever had in the past. Previous, it was, okay, behavior placement. And now we're like, no, they need to remain in the
Home
community.
services.
So we try absolutely everything within our power to keep them in the community. Like you talked about, that behavioral health, that parent education, parent coaching. We're doing more and more of that now. So when we say we're placing kids in these high buck placements, we have tried everything.
Right, that's your inpatient care versus the outpatient, working with the families and the children. So that inpatient care, to me, that falls under the mental health initiatives that we should be able to tap into some of those funds that help pay $9,000 to $30,000 a month for placement.
Once those kids go into placement, their benefits stop.
See.
One of the things that we've been working really hard, behavioral health and DCF, is for those kids that are kind of ramping up and that we're seeing, because we're seeing them in crisis more. So they're, mobile is going out or they're calling Northwest Connections. So our teams are working really hard together to get those kids into the CCS program. I think about 80% of our CCS consumers are kiddos.
So it's comprehensive community services for the acronym deficient people.
Oh, yep, right.
And that is it's a program that's self-guided or self-driven, that provides those services so people can stay in the community.
We have
And it's
about
100% funded by the state.
right now that we serve.
So I think a thing that, we're identifying trauma, that these kids have gone through significant trauma in their lives. And to be able to treat that trauma, there's a window in that child's life when you can get them into therapy and have them be responsive to that treatments to build resiliency and those types of skills. So some of these kids that we're seeing, we're beyond
Okay.
that window. So we're identifying too, like, are they a candidate to have that trauma therapy to be able to overcome some of what they've been through in their lives?
But then they also need every caregiver, every adult, every person in their lives to be trauma responsive on top of that, right? And there's just a lack of knowledge about that as well.
Right, because there is a second.
Homes, foster kids we have within our county.
Foster homes in the county?
Oh, gosh. I want to say we've got 15 licensed foster homes. One of them is that high acuity home. But the majority of our foster homes, when we call about these kiddos, they can't take them into their home because they've got young kids, just the threat that
It's a
they would
safety
pose.
thing,
Yeah,
yeah.
it's for sure.
That's our big need in the county is foster place.
High acuity foster
High
homes.
acuity foster homes
Yeah.
is.
They-
Bill had a question.
So, Lee, you said that out of those 9 kids, there are 6 that are special ed, okay,
Special needs.
or special needs, okay?
Yep.
I take it that you have emotional behavioral disability versus the LD, the learning disabilities. So my question is, federal law requires that every special needs student is serviced until age 21. So what's the determination when you're going to place a kid? How long do those services last? Do they last until the kid is 21 as far as placement?
They can. The statute allows for that. However, we don't practice that a lot because that's,
Well, through DPI though.
Okay, the reason I asked you, I understand that, but I'm not sure if
Right.
you're not in a school setting,
Right.
you don't understand that a special needs kid has services until age
Right.
21.
yeah, right.
And so the caveat that goes with that is, so the behaviors that you described at the beginning, okay? Who makes that determination if you have to go to court as to whether or not that kid is going to be placed in a correctional facility or long-term placement because of that behavior?
Who makes the decision? Who?
Yes.
The judge ultimately makes that decision
Okay.
based off our recommendations. And when I say us, it's the Department of Children and Families, and that's where that YASI screening instrument comes through. There's certain criteria that needs to be met based on like what level of care they're going to do.
But as far as the right to that education, those education services, we try to work with the schools, but sometimes these kids their
They get
behaviors are.
expelled.
And I understand
Yep.
that. I certainly understand.
A lot of these kiddos are expelled from school.
I think going back to what you said regarding programming, from the mental health thing, and then a comment that was made over here, that wraparound program that you have, that's probably the most important thing that kiddo can hope for. So you have family members, you have the school facility, you have your mental health workers, you have law enforcement, and of course, Lee, you're involved in that. So knowing that, to me, that's pretty protective services for this. And yet you still have to treat that kid because of their behavior. So I understand the cost is crazy.
Yeah, so we do an independent living skills transition plan with all kiddos that are in placement, and we work with workforce development. They've regionalized that across the state. It used to be every county had an independent living program, and now it's regionalized, and they do such a great job of setting them up for independence once they age out of care at 18.
If they're appropriate for community placement.
Yeah, or they transition to the
Otherwise, they
adult.
transition into the adults.
And and I'll just say this, I'll blurt this out. I think I was fortunate when I was over at the jail, not as an inmate, but working over there with those kids. Well, easy. I think it was fortunate because I had the opportunity to take a lot of those kids out. They're still inmates, but I could take them out and bring them over to workforce.
Yep.
And sit down and do that interview with them. And I felt good about that because then the nicest thing was we could get them into Bishops, for example, and they only had to walk from the jail over to Bishops. And Bishops could take them through the workforce thing. And that was nice because then they learned those workforce skills.
We have quarterly meetings with them to
Yeah,
make sure
and
that
I love them over there.
They do a nice job, for
They do
sure.
a nice job with those kids.
You have one
Madam
last
Chair?
question.
Okay,
I have one too.
oh, okay.
Go ahead.
Do you want?
So you do,
Trying to have,
No, go ahead.
okay.
so you do a really good job, keeping your finger on the pulse of, what's going on in rulemaking, et cetera, et cetera. But what kind of legislative pressure can we put on? Or is being currently put on? Is there, I mean,
What's the hope?
Yeah, so this is something that we discuss monthly at our meetings because Polk County is not only, every county in the state is recognizing this and having these difficulties. What is really nice, I will say, about Tennessee is they have, their programming is residential. And then if the child needs a higher level of care, they can move over to their psychiatric unit within that residential placement. We don't have those facilities in Wisconsin. It's my understanding in order, we used to have child psychiatric facilities, but they got away with it years ago. And I remember Jamie Fawcett saying there was some talk at that time going, this is really going to affect us years and years down the road. And I think we're seeing that. That would mean changing the state statutes to allow these facilities similar to youth villages in Tennessee.
So yeah, so having like, on campus, different housing to meet the needs, so they can, without having to jump through, oh, well, now they need institutional care, so we have to go back to court and we have to, do all of the, get a different court order and, it just takes so long to.
kind of based on like the nursing home,
Mhm.
where you do the assisted living.
Yep, you just graduate.
You graduate.
Sometimes you go backwards, sometimes you go forwards.
Kind of a wraparound.
Sounds like way too much, too much sense. Yeah,
You just slide people where, what their current need is, meet them where they're at.
too much sense.
Yeah, because right now there's Mendota Hospital and that
Madison.
it serves juveniles.
Yeah.
But they only take in kids from corrections. So we can't even make a referral there because that need is so high for the kids in corrections
Oh,
to use those facilities that they get.
And those are probably $1,200 to $1,500 a day placements
A day.
a day
Oh.
that come out of our levy. The one that Lee is talking about is Southern Center. And that was one of the 3 state-run institutions. So there was Northern Center, Southern Center, and Central Center. The Southern Center campus dealt with the kiddos, and that has since closed down a long time, along with Northern Center and Central.
hey Rita, hold on a second.
Getting.
Ryan's been waiting patiently.
She sounds like she has a specific question though.
Oh, okay.
No, I was just gonna say, what are you perceiving for your community resources like churches and community those, all or is it all? The government responsibility.
So we get a lot of services through CCS and that behavioral health for community. We've been able to work with some local law enforcement about like giving back to their community, whether if they committed a delinquent crime. I think in Milltown, our workers worked really well and they painted a wall, some kind of giving back.
Service back to the community.
Sure.
What about other community organizations such as churches, types of, institutions within the community? Because it feels like this is a big burden on the government.
Yeah, so as far
Infrastructure of families, churches, other social supports that.
some of those
seem to be
pro-social.
Like gone or not there.
Yeah, that's definitely something that each youth that goes through our youth justice, that Yazi assessment that I was talking about, they get a plan out of that. And some of that is pro-social activity planning because we know that how important that is to be connected to the community and feeling a part of the community.
And those kids feel like they're an island already.
Yeah.
So I need to integrate into it.
Well, and I would say that they would have to score low enough on the Yazi to be able to be referred to those programs because as you know, we work with kinship of Polk County. These kids are not even close to being appropriate for a kinship mentor. So they have to be appropriate for the community as well, because we wouldn't want to put a volunteer at risk or a different organization at risk of
I see.
getting attacked or.
So these are the words.
Yeah.
Sorry, Ryan.
No. It's actually kind of a decent segue because so we were talking a little bit ago about like a thankless job. And I think we're kind of getting to that now. how important it is that we have people like you guys that are specifically focused on this, because you look at the scope of drilling down to even 6 kids of 9 kids of this many. But it's bringing back memories of I worked for only a year at Northwest Passage Riverside, and that's the boys only in Webster. And the kids that end up in that place, you can't even describe, like somebody had just said, they're on an island. You can't even describe the feeling that some of them have of being disconnected and given up on. And what a lot of community members see is, delinquent and behaviors and things like that. But you've nailed it on the head that it is a result of trauma, not just one time, but over and over again, years and years. And by the time they get to 15, 16, 17, 18, and that's been hammered on them so many times, without going into a big rambling mess, this is so important because the reactionary stuff is important because those kids need support. They're still kids. A lot of times they've been forced into being adults at young ages for any number of different reasons. But for the protection and the safety of themselves and the community and everything, the reactionary stuff is super important. But I liked what we talked about a while ago, and it's super hard to support that for a million different reasons, because a lot of times it ends up being just talks about dollars and cents. But when you see the impact that it has on some of those kids, it's amazing. But then the other side of it that we talked about, and this is the long term, got to dig your heels in kind of thing, is changing the climate within the community to avoid those traumas from happening so often to so many kids. And, whether that's substance abuse efforts or just general supports within the community and everything like that, like that's because you're not going to see a switch flip all of a sudden and behaviors are lessened because traumas have lessened. Like that's going to be, unfortunately, a years long, decades long, potentially process. And I guess I'm just saying, I like that there's a glimmer of conversation about that. Not only that you guys do all this stuff behind closed doors, with limited support, whether it's manpower or budget, but just that the community can see like the focus that needs to be on getting rid of that source that we were talking about of that initial trauma. That is the reason that this happens from generation to generation. Like I think it's a misconception in the community that you've got bad kids with bad parents and it kind of is limited to that. It's handed down, and we're seeing the exponential effect of that now as that goes from generation to generation. So I would think, and again, with no scientific evidence to back it up, that as you see that compounding year over year, that's why we're going to see increases in numbers and everything like that, because I went to school with people that have 7 kids. That's 7 more opportunities for that to now branch out. And so, thank you to no end for everything that you do, because it is the hardest freaking job in the world. And you go home with those same traumas as the kids do, and that can compound on your own self. But then also just hopefully everybody can kind of focus on, like we said, that root problem.
Yeah, rather than asking the question, what's wrong with them, asking that question, what's happened to them?
Because the reactionary stuff is needed because those kids need support. But then we need, as a community, to take steps towards removing the source of the trauma to begin with.
When I listen to what you're saying, Ryan, thank you for that.
Yeah,
Sure. It's called prevention.
Ding,
Ding, ding. Prevention. And prevention isn't something that happens today, tomorrow. It happens in 5 years. It happens in 10 years. And we got a lot of catching up to do. And we are literally seeing 4th, 5th, 6th generations of methamphetamine users. So think about that over time and what that looks like. So when we talk about the prevention things that we're doing in CSD, they're not magical and they're not going to happen quickly. It's got to be something that we look at long term and strategic planning for that as well.
Right. Did you want to add to that?
I was just going to throw out, so I was going to talk about these later, but they fit perfectly here. So talking about the youth connections and resiliency piece, we had the Lionheart experience presentation come to 4 different high schools. It was a raving success last week. Staff and students were getting tons of feedback that that's exactly what they needed to talk about that youth connections, resiliency. So we're already starting that conversation through the Drug Free Communities grant. And that kind of spills into our youth summit that we're organizing for July for middle school students about youth connection, resiliency, all those stuff we're trying to get upstream. And then hot off the press in April, we're organizing a maternal child health kind of summit, I guess. So we're getting all the community partners that touch the lives of pregnant, postpartum and parenting people to talk about like what barriers do you see, what services do you offer, and just getting those connections, and then how can we improve those services? So we're looking way upstream, but like at the point of like pregnancy, how can we support those parents? What do they need? So we don't have to use lease services in the future. So
Work ourselves out of jobs.
exactly, it's coming.
Well, and then kind of segue to that, sort of with what behavioral health is doing. Of course, we're working through prevention. We're also working with partners for, like we support recovery and doing pro-sober, pro-social events. So for those folks who maybe have been impacted by drug or alcohol use, we're working with them to provide them additional supports so that they can stay on the path of recovery. I don't know if we're gonna do more stuff at number 12.
So,
I got for that.
I have the numbers for behavioral health because that's touch and go too with our Winnebago placements. So hopefully we don't have to bring that report to you on the adult end of the spectrum, but this is one we're going to keep an eye on. Obviously, we monitor our budgets very closely. We'll keep an eye on those crisis type of services in behavioral health too. Yeah, so.
I have a quick story. I did go to treatment court a couple weeks ago, not last week, but a couple weeks ago. And I walked in with this young man, and 2 days later I was at Walmart buying a hard drive and trying to figure out what the hell I needed. And he was helping me. And so it was just a joy, of course I didn't mention it because I'm not an idiot, but I did have a lot of fun with him. We had a lot of fun together. And he was he was shiny, and he was new in his recovery because, they have to say how many days they were sober. And it was all I could do to just not hug him. It was just such a joy to like be in treatment court. And then 2 days later, and encounter this young man doing his best to turn his life around in working at Walmart, helping this strange old woman deal with her hard drive. So it was just great to see such a direct connection from the work you're all doing that treatment court is doing, and then seeing it in the community like that.
We are looking at family treatment court options in Polk County. That's a new thing that we're looking at.
Yeah, that's awesome.
Sweet. Options?
Family treatment court.
Good. That's the way to go.
Group.
Yeah, I just want one.
Did we have one graduate last Friday?
From treatment court.
Treatment court,
Was it last Friday or 2
Yep,
Fridays?
last Friday.
last Friday.
Last thing.
You have one more?
Yep.
You have a question?
I do, Madam Chair.
Go
Thank
for it.
you. One last thing.
Take
You
your time.
know, we are a very welcoming committee to all of the data that you spill forth. And I just think that it can't stay in this committee. I would propose that you give this presentation to the county board. At least it's gonna be, if it bounces off the wall, fine, but hopefully it'll stick in a few places. And they'll understand the impact, the budgetary impact that's going on right now, and how important mental health initiatives are. And that's like one of the things you should never say no to, right? Anybody that says any no to any kind of mental health issue, and for it to be available to people, just, take a ride around Polk County and you see the signs of mental health in the way the junk properties are, and then just ask yourself, are there children growing up in that situation? Et cetera, et cetera. It's not only in this arena, but the root is deeper. And everybody needs to see it with the potential of putting legislative pressure outside of the budgetary pressures, right? Sorry if that wasn't,
Get that done by Monday.
sorry if that wasn't clear enough, but we did. Jay, this is good stuff for the county board to hear, and I hate to just have that presented in a friendly space where everybody's gonna be like 45 minutes into a presentation, you know, and then have it lay there afterwards. It's anticlimactic for you. It hits your morale, and that's it. That's all I got,
No,
man.
good. That's good.
Thank you, everyone.
Thank you, guys.
Thank
Of
you so
course.
much. for what you're doing.
Okay, so here's where we're switching the agenda up, as you recall, and we're gonna move straight into number 10 and have an update on housing.
Yeah, I guess Don was invited to be the county administrator replacement stand-in guy.
Just tell us it's all taken care of, right?
We'll turn it over to Don for that update. And then I'll be back.
We'll be back. I feel like it's worth saying that even though this may feel like a thankless job from time to time, you've gotten some good work done. So Tanya drew your attention to this list. Way back when I was working with the extension, and we did this for the first time, there were 4 items on the list. Now there's 6. And there's one that didn't appear 4 years ago, support housing initiatives. So I think I'm going to give you some information that'll make you feel good about the work you've done on that. The board passed a resolution allocating $200,000 to support housing initiatives. And for a long time, it just sat there. It's still sitting there. But we have an application from a municipality here in the county for 7 units worth of funding. That'd be $70,000, 7 times 10,000. Overall, it looks like it's about a $2 million project. I can't give you too much detail because we haven't even evaluated that. I'm just giving you the advanced information on this thing. About a $2 million project on 10 acres. A couple of phases, it looks like. The first would be 2025 twin homes. So we call those duplexes where I grew up.
Right? Right?
So that's, workforce housing. It sounds like, again, we don't know all the details. And there may be as many as 42 units put up on this 10-acre parcel. So I'm really, really thankful that you all did the work at the committee level and at the board level to get something moving on housing in Polk County. I think that's just fantastic. So thank you for that. It's not totally thankless. Thank you.
Yay.
We also have a conversation going with another organization. And we haven't seen an application yet, but they're also, in all likelihood, going to be asking eventually for up to 7 units worth of funding, also here in the county. So we've got some great stuff happening around that, thanks to the program that you put together last year.
Are we able to know what municipalities either of those are in?
You absolutely, but I have, like I said, the committee hasn't even met to review. This thing just came in late last week. And the 2 conversations in the same week, 1 application, 1 hasn't got an application yet. But I'd feel like without Mo and Malia here, it might be a mistake to reveal much more than I've already revealed.
Can you reveal if it's a village or a town or a township?
Or
Like a town?
I can say it's a city.
Okay, that's.
Ding, ding.
Oh,
I think that's
That's
okay.
okay. I was just having it. A zoning question. Okay, anybody else have any? That's good.
Yes, sir.
Is that either a West Cap project or not?
I can say that there's a private developer involved. So it's a private for-profit developer. Anything else?
Yay.
Congratulations.
I know, right?
Okay, number 11, communicable disease report.
Sure. In March 2024, we had 2 COVID-associated hospitalizations, 6 influenza-associated hospitalizations, and 3 RSV hospitalizations. 2 chlamydia, 1 Hep C. That's fine.
Winding down a little bit.
Finger.
Yeah, careful.
Dr. Lagus, did you have a your regular
Well, yeah, I think that the influenza and infectious disease numbers are down and all over the country. But there's still some influenza and some COVID, and COVID is still alive and well. So we still recommend people to have a booster. If you're over 60, 65, I think you're 65, they will pay for that. And there will be a new booster in the fall. So currently, Dr. Mike Osterholm is recommending that we not think that we only get a booster once a year, that we probably need boosters for a while every 6 months. So you have to kind of look back and see when you got your last booster and say, okay, I'm due for another one. So,
Yes.
so because what happens is that I saw this article in even on that influenza vaccine, you lose 9% per month of your immunity over time. And it's similar probably to the COVID vaccine that you and that this is true whether if you had the infection, you have a certain level of immunity, but you also lose part of that immunity over time. So you can't assume that because you've been infected once that you're not going to have another. And at the current estimate that I saw was at least 1% of the people who had COVID will get a repeat episode of COVID. So it's so yeah, it's a small number, but the more times you get COVID, the more likely you will end up with long COVID syndrome, which can happen for months to years. The most serious ones are people who have had long COVID for a year, and so far, everything that I've read, still not sure how to treat that. Like people who, and for a long time we thought that people didn't get Lyme disease, but I think that's probably, we didn't know. And then we think that there's Lyme disease now too, so it's kind of, so, and unfortunately the vaccine that they came out with was a good vaccine, but there are too many lawsuits, but the manufacturer took Lyme vaccine off the market. So, but there's 3 vaccines for COVID and they're all good, per Dr. Ostrom. Anyone, it's a matter of getting the shot in your arm.
Anybody else? Are we done? Is that it? Got anything else, Ellen? We're good? Okay. All right, thank you. Thank you, both of you guys. Do we have a legislative report?
Yeah, I was just looking to see if there were any updates on that Act 97.
Yeah.
And I'm not seeing anything, so it feels like it's been stalled out by Joint Commission on actually passing it and getting the money out. So that's kind of disappointing, but way beyond our control. If anybody needs those talking points I sent out, just let me know.
Yeah, it sounds like there's still an opportunity to send something in, so.
What is the subject of that?
So for the crisis funding with the HS closures in the Chippewa Valley.
yeah.
So one of the bigger impacts is people are being transported to Winnebago more and more. We've always gone to the first. It was rare that we could find a place at Sacred Heart. So a lot of our people did end up going to Winnebago with the closure. Everybody's going to Winnebago. Also, the substance use inpatient treatment facilities are also closing down. So just a really big impact on substance use and mental health services, crisis services.
Thank you. Okay. All right.
I think I could maybe get a couple points on legislative.
Yes.
For the first time, and thank this committee, for the first time in history of Polk County, we had 5 resolutions that I introduced to the Wisconsin Counties Convention, and 3 of them were from the Health and Human Services, 2 of them were from the Sheriff Department. Unfortunately, the legislature did not recognize, in 22, Golden Age Manor received 900, and I think $70,000 from the state funding. And the legislature, they appropriated the same amount of money, but they redistributed it to, like, for instance, Racine County, I think, was one of the counties that was losing money. And for the 23 budget, I believe Golden Age Manor went from 970,000 to like 78 or something. So this committee I had a resolution introduced, to redistribute that. Yeah, Dana said that they did receive some other partial, so she came up with a pretty good budget.
And maybe next year's resolution should be something along the lines of what we just talked about for this, release the funding for these.
Yeah, I think we'll come
That's-
up with pretty much the
Yeah.
same thing in maybe different format. Right now, we're in, with the April elections, but I would imagine we met quarterly.
Right.
And I would think that probably in June, I get reappointed to that, I'll be introducing some more. We're getting, Polk County, after some years of trauma, we're getting good recognition, and all these 5 resolutions passed without one dissenting vote. So that was
Great.
good support for
Yeah.
our
That's good.
needs here,
Well, thank you for doing that in the next 2 years.
hopefully.
Okay,
All right.
agenda items for the next,
Oh,
well, I'll just put number 9 at the end. You want to subject? Or did? Here, you want the,
I just need to see the work plan. One here.
does anybody have any specifics?
Well, 2025 budget priorities discussion is up on our work plan for May. Preliminary end of year financial report, and that would be for 2023, correct, Don? Yes.
Yes.
And establishing budget priorities are the 3 items that we have scheduled.
Okay. Sounds good.
We'll
Okay.
receive 4 new members at the May meeting. And then in June, we'll do that orientation that we invite everybody to come to.
Good. Okay. Thank you for that. Okay. Now we're gonna loop back up to number 9 and do the community services division update.
Yep, so I think these guys have 2-minute speeches for you for the departments. So I'm going to invite them up first and then I'll do the grand finale. So who wants to go first?
I can.
Okay, Lisa, behavioral health.
Nice.
Timer. We will time you. So yeah, just kind of talking a little bit about what kinds of things, initiatives we're working on right now. We are in the process of developing a quality assurance, quality improvement tool. I talked about that a little bit earlier. That is really kind of in direct response, I'll say, to a payment integrity policy that Wisconsin Medicaid has put out. So we just seen this as an area that we could really boost up in. We are excited about being staffed almost for the first time in 3 years. So that's really exciting. We're looking at some additional prevention opportunities, treatment recovery as well. We are ready to roll out wraparound services in our CCS program. That is taking in earnest on June 1. Let's see, we're working on a new consumer satisfaction survey. Ongoing work on our electronic health record with tweaking that to work for us as much as we can. As far as wait lists, we don't have anybody on a wait list to get into any clinic services currently. We have 1 on the wait list for community support and 1 referral pending. We have 18 individuals on the wait list to get into CCS. And we have 17 individuals on the wait list for our dual, which would be CCS and CLTS. Big things for me right now is, looking at additional grant opportunities that we have. There's a 988 grant out there, which is, for suicide hotline. So we're looking at what kinds of things that might mean for us, as well as exploring a collaborative relationship with some other folks. And then really, policy review, making sure that those things are up with snuff.
as always, reviewing and developing new ones as things change. So.
That was
Questions?
great.
Nothing going on.
Okay,
Wow. Yeah.
Yeah, 30 seconds.
public health. We're very excited to welcome, we have an occupational therapist and a speech language pathologist that are joining on staff on our Birth to 3 program. So at the Prevea HS closer, we're able to bring them on staff, and then we'll also be contracting them with other counties to provide Birth to 3 services. So sharing the resources we do have. It's very exciting. Dr. Kimberly Alcoyne, our voluntary medical director, has resigned. She'll be leaving us in July. So we are on the search for another voluntary medical director. If anyone is aware of someone who might want to fill that role, that is a need. Our maternal child health program. So again, we're working on just gathering everybody in Polk County that serves those populations. So right now we have 10 different agencies committed to coming. So like Amory Hospital, OMC, St. Croix Health, United Way, Success by 6, St. Croix Tribe, public libraries, Family Resource Center. So it's really cool to see the whole community coming together to talk about like, let's work smarter, not necessarily harder, but like how can we join forces and collaborate? Our drug-free communities grant is rolling strong, getting that youth summit plan for July. We have the POP program, so Power of Produce, coming this summer, where kiddos can come to any or one of the 4 farmers markets. Again, this is a big collaboration between the medical centers, St. Croix Valley Food Alliance, like other partners too, but kiddos can come to farmers markets and receive $4 tokens to try any fruits or vegetables. And then we're also doing a whole lot of just like farmers market messaging too. So how you can use your senior farmers market check vouchers, how you can use your WIC farmers market check vouchers, just all those opportunities. We're partnering with the AVRC to offer Stepping On. It's a fall prevention program this summer. And then we've applied for a routine childhood immunization grant. So hopefully we can increase access to education and access to immunizations too. And this is like the tip of the iceberg of what public health is doing, but the wow.
Hey.
Yep.
They're fighting over there.
Good job, Wade.
All right, well, I talked a lot about the high acuity homes, so that is a big focus in Department of Children and Families is the recruiting right now for that high acuity position I talked about earlier and the recruitment of those high acuity homes. We're also working and looking at getting family treatment court here in Polk County. A team went over to Barron County and observed their family treatment court. And CJCC did a presentation to it to our drug endangered children team last month. So we're looking at starting that on a very small scale. We have a meeting next week with the partners for that, Corporation Council and Department of Children and Families, to discuss that more. Next week, we start our strengthening families and systems training. So we've been doing this training in Polk County for 8-10 years. So this is how to be trauma responsive. So this is a really important training near and dear to my heart. But this teaches caregivers, everyone that works with just humans or in contact with humans, on how to be trauma responsive and how to address those really complex behaviors. So we encourage all DCF employees are mandated to take this training. And then we encourage all foster parents and anyone living in Polk County to take this free training. We also started amping up our collaboration with the St. Croix Tribe. So now we are meeting face to face with them monthly. This has been really helpful because we're seeing more and more cases with them. So it's teaming those cases together, and they are actually taking some jurisdiction over some of those cases, which is great. So they're taking all of the jurisdiction and all the case management placement of those tribal kids. So we're meeting with them weekly, and we are now meeting with the Polk County Sheriff's Department weekly as well. So they are joining our child protection meeting every week, and just kind of collaboration, talking about interviews and case specific stuff. They really help us out a lot with that safety piece, like we talked about earlier, but they know some things about cases that we don't know, and we have some information that they may need. So it's been helpful it's been helpful for our workers to get access to some of those families that we need access to determine safety. So those are the big updates in human services, or I'm sorry, DCF.
Formerly known as.
As human services.
All right, then from the world of economic support and the Great Rivers Consortium. So our staff have been in unwinding from the pandemic for the last 10 months. So what that means is a number of our old policies for food share and Badger Care, Medicaid and childcare were put on hold. And so now we are transitioning back to some old rule, but a number of our old policies also have been revamped at the federal level. So we're trying to also teach staff new rule, or revised rule, I should say. So with healthcare renewals, we are in month 10. So all consumers will have completed a healthcare renewal for the first time in 3 years. So we've seen a big shift in our consumer base as far as healthcare coverage. With that comes a big change for our childless adult population with Badger Care. Previously, they had always had to pay a monthly premium to be eligible for Medicaid. They no longer have to pay a premium, nor do they have to do a treatment needs question or do the healthcare survey. So trying to keep our childless adult population insured as well. And then in April came monthly premiums for our Badger Care population with children. So any family that has income over 201% of the FPL, their children will have to start paying a premium as of April. However, with that, there is no penalty for non-payment. So if they pay, great. If they don't, great. They get to stay on anyway. And then with our Medicaid purchase plan program, which is for our disabled population adults, in January, the work requirement came back for a lot of them. And so that has been a big change for that population. And for them, work doesn't mean that they have to go to, say, Walmart or Bishop's or whatever to work. They can do in-kind income. And that's what the bulk of that population does. They might take their neighbor grocery shopping and that meets their work requirement, or walk their neighbor's dog. So that work requirement came back January 1. And then a big change for that population is come August 1st, they have to go back to paying a premium as well, monthly premium. So they've been kind of transitioning that program for that population. For food share, big changes. Under food share, we have waived food share interviews for months, years. Our adults that are over age 18 have not had to have employment, so haven't had to meet certain work requirements. We have gone back to that, and what impact that has on them is if they don't have an exemption and we say that they're required to work, if they are not working, they only receive food share for 3 months out of 3 years. So we've seen a lot of that population drop off of the food share benefit, and that's probably had a big impact on them as well. One thing that's happening this summer, under COVID, the state and federal government worked with our school districts to put more food share in households to help with food. So with the pandemic ending, the federal government has released that they are going to continue with the summer EBT program, which is a food benefit program. So any family that is currently receiving a free or reduced lunch program through the school districts will be eligible for the summer EBT program. So what that means is any child that's school aged will receive $120 in extra benefit for the summer. So if you have a household of 7, that's a lot. 7 kids, that's going to be a lot of extra food money into their household. That benefit goes on to the same food share card that a food share recipient receives as well. And the federal government figures it'll affect about 29 million children nationwide. So that's what I got.
Thank you. Any questions for subject matter experts? Okay. Winding down. Grand finale. Maybe. So as we know, we are going to be receiving some new members. So we've got 4 of our county board representatives outgoing. This is their last meeting. And so I wanted to do a little bit of a recognition And rather than just recognizing the 4 who are outgoing, I thought it was interesting to take a look back and see what the history of representation on this committee has been. So I just want to mention, we've got some longstanding members. One of those county board representative is John Bonaprise. He's served on this committee since 2014. So he's 10 years running. He's been chair on and off. When I talked to him yesterday, he's one of these guys who did a 10-year and then an 8-year break. And then now he's been on 10 years again. So he's got 20 years of experience on county
If you
board.
knew how frustrating that 8 years was.
Yeah, so going strong, 2014 to 2024. It'll be at least until 2026, right?
Yeah.
So thank you for that service. Then down to our community members. I did have to call Dr. Lagus yesterday too, just to make sure the dates were right. And he gave me education. So he has been on since 1999 as a community member of this committee. So, years there, and I don't know, did you find? Okay, so he was on, and he was like John Bonaprise, that he was on previous, back when Bev Larson, if anybody remembers Bev Larson, she was the health department director, health officer. He was on for 3 to 4 years, took a little time off, and then was reappointed in 1999, and it's been going strong ever since. And then Bill, I had to email him, he's always running around doing things, coaching baseball, whatever. So he's been on as a citizen member since 2008. And that, he's told me, was a month after he retired from Unity. They snatched him up because he didn't have enough to do. So he's been on since 2008. And then
Wow, thank you, Bill.
the 2 newbies are Sabrina Meadow, and I'm not sure if she's on virtually or not. She's been on since 2018, and Rita McKee has been on since 2020. So the cool thing about our citizen representatives is that they are subject matter experts on the work that we do. We've seen that time and time again as they meet in committee. They're able to provide us with the information we need to be able to deliver those services. So very thankful that we've got that level of expertise on this committee to guide us. So thank you guys for that. And then, the four of our outgoing members. So we have what we've seen, you support us through this committee, is first of all, COVID, right? So when Amy got on county board in 2020, the pandemic hit. I think it was high gear right at that time, right? We were ramping up. 2020. So you guys supported us through all of that. Uncharted waters. We kind of made it up, I think, as we went and figured it out for the last 4 years. And I think we're hopefully on the tail end of it, but I put COVID 2020 to 2024. So the 4-year term person, that's been your reality. The 2-year term people, that has been your reality, and you've been baptized into all things health department and community services that way. Some of the other accomplishments I just wrote down quickly. Smoke-free air ordinance, you've been active with that. As of late was the fentanyl test strip resolution that ended up being defeated. And I think, there's just appreciation for everybody on this committee for your attention to the detail and listening to the data and finding the facts and making those informed decisions and supporting us and advocating for the citizens. It's not just us as a department, it's for the citizens in the county who we serve. So thank you for that. I did note that back to Bill and Dr. Lagus, they were around when H1N1 came through.
Oh, wow.
That was only a year though, so. But just the level of support and advocacy has not gone unknown. So with that, we have Denise LaAllier-Prey. Is this your last meeting as a county board member? She chose not to run for re-election. And so she was appointed or won the election back in 2022. Barbara McAfee, also a 2022 election win. Ryan Wood was also 2022, and Amy Middleton. So if you guys want to come up, we have a little card and appreciation for you. Not too much kumbaya, but you want to come up?
Not done yet. Just candy.
Thank you, guys.
Yes. You and swag, huh? Swag.
Ryan.
Oh, yeah. You're right. I remember that.
Paper bag, yeah.
It was.
Purging stuff right now.
There's all kinds of goodies in here, so.
Thank
I love
you.
that.
So much.
Thank
Thank
you.
you so much.
So on that note, each of us have probably something to say. Ryan, do you want to lead us on a little mutual gratitude moment?
Yeah. We were kind of talking before this meeting started, and it was actually, it's content within the meeting for all of this, just how important all the work is that you guys do, not just in the decisions that get made within the committee meeting, but then you got to leave this room and go put everything into action. So I won't pretend that I knew even a tenth of what I know now before I started. So you guys did a great job teaching me, bringing me in, giving me all the important information that a person should know when they're making decisions on these kind of things. It really is a community services division. You guys are community focused and doing all of that. So I really appreciate just the collaborative work that you do, the community focus that you have. It's community centered. And I hope that you can continue to keep doing that and just keep your heads down and keep doing the great work that you do. So thank you for everything. And it was awesome working with you guys, and great. As much as you might not have thought, it was great to hear from you every month.
Right. Did you have anything?
Oh, I see you. I hear you. I appreciate you. I mean, I like to think that you know, they say teach an old dog a new trick, and after being in a the environmental health safety arena for 22 years, with worker safety and community safety to some extent, environmental safety, I've had my eyes opened, and I really, like I said, I see you, I hear you, I appreciate you, and keep up the good fight. I'm hoping that the next group of board members do the same, and I think that some of this stuff needs to go higher. You need to get at a higher level, because we should all be dealing with in a nonpartisan, fact-based, eyes open manner. And data, plot, right, Don?
Said it better.
Thank you. Thank you. I think what these guys have already said, it's amazing, and all the work that you guys highlight each month is just like, holy smokes. But I watched you guys, holy moly, come through the COVID. Remember, I mean, you guys had to reorganize your offices. You had to send people into the street, into their homes to make phone calls from afar. We were over in the highway doing half of our work, or you guys, we were sort of helpers once in a while. So then to see this rebuilding, I mean, like, I remember meeting with Ellen a long time ago, and you and like watching you kind of go, oh, sheesh, I think we can pull this off. And you did. I mean, you guys rebuilt and came back, I think, stronger than before COVID. So huge kudos to that. I also really appreciate like the collaboration that you guys do with the police departments, with our schools, with our other partners, that you realize that we can't do this alone and are fully open to other people helping. So That's really appreciated and noticed, and we see that. And then lastly, just take those flowers that I brought and just spread them throughout the office. Do whatever you want with them, just, so. With that, do you have something to also add?
Yes, I do. Kudos, yes, kudos, celebrate, grateful. I have learned so much and I talk about y'all all the time and I will
Yes.
continue to do that because I think people don't know what you're doing. And thank you for being willing to step in to deal with people no one else wants to acknowledge exist or don't think should exist. So I really appreciate that work. And I want to sing for y'all. Because that's really who I am. So it's just a part of the song that, and I would like to send it to you so you can share it with the whole committee. This night's not gonna last forever. You won't always feel this way. But for while you're feeling lost, I'll stay beside you. I won't say much, just hold your hand and listen to you breathe. Pray that your own light will come to find you. I wish that I could show you. I wish that I could show you. Whenever you are lonely or walking in the dark, I wish that I could show you. I wish that I could show you the astonishing light of your being. I think that's what you're doing. I hope that's, you see that that's what you're doing. And
Madam Chair, Amy, can I make a comment before we
Yeah.
adjourn?
Yes.
First of all, I want to say I plan on carrying on the work that the committee is doing. And this ain't the end for all of it, for any of you. I'm gonna be in touch and I hope you keep in touch with me with your ideas. I've learned every one of you has made a lasting contribution to this committee. It's, I've got 20 years in and I never was on the human services till about 2014. And Amy, you're gracious, open, dedicated leadership. It's something that was a great experience for me. I've never seen a county chair at a human services meeting in 20 years until Jay has been elected as our county chair. Jay, you've kept everything open on this committee. For once in the 20 years, Polk County is really recognized on a state level. We had some traumatic years when Polk County was reprimanded for different things. We wasted a lot of money when we had some county board supervisors that took over and thought they could run the county, and we paid multi-millions of dollars in we had to pay our dues. And I want to continue being on the committee. Look for your support, and I'll do the best to be a good listener. And everybody thought, when Gretchen Sampson retired, that it was going to be, I guess, the end of a lot of things. And Tanya, you've been 24/7, and that's just amazing. You've been the best department leader that I've ever worked with. So thanks again for everybody's support.
Thanks, John.
But that I make a motion to adjourn.
Oh, no.
Oh, we're not done yet. Oh, no.
Just from me, on my behalf, for the four of you, your collective wisdom, what you brought to this committee, to me, since I've been on this, has been absolutely remarkable. Thank you. Thank you for being a county supervisor. Thank you for being on this committee, whether you volunteered or not. And thank you for your service to everybody in Polk County. Greatly appreciate it.
Yeah.
Thank you.
I couldn't say it any better than he said, because I really also appreciate all four of you
Me too.
and wish that you could have continued.
We do too.
Me too.
Yeah, thank you.
Good for the committee. Anybody else?
And I do want to echo, you've rocked as a leader here and really appreciated your care and work. And
Yep.
Tanya, you're a rock star. Grateful for
It's
you.
been great to work with Tanya.
And Jay, thanks for showing up and thanks for your leadership here and in the, I won't see you again in the larger one, but it's just been a joy to be led by you and appreciate your humility and humor and good sense and dedication. So thank you.
And can I echo that, Jay? I think you've done an absolutely outstanding job of lowering the temperature, cleaning up some messes, and getting the county back in a positive, what John always talks about, you know, a positive place for us to be. So thank you, because it allowed the rest of us to kind of do our jobs in our committees, to not have,
Pleasure.
hopefully you continue to do it. So thank you.
I feel like I want to come to the next board meeting and do a public comment / endorsement for you because your leadership is just very top notch. Sure. Your advice is sound, your direction is clear and nonpartisan and well-informed, and I can't say enough good. That's after,
I always said it's supervisors do the work. I'm basically lazy. And
Oh, yeah. Yeah. Sure.
that shows, hopefully it's benefited the county much by that effort. Thank you for your comment.
it's accounts.
Anything else?
Thank you, Eve.
There's a motion on
Is
the,
there a motion on the
second.
floor?
oh, Miriam, let's hear from the, Miriam, go ahead.
I just say a word? I am so impressed. And there have been so many beautiful, all the thank yous and so many eloquent, speeches, so to speak. And I just want to thank you so much, but most of all, I want to thank you for saving my husband. Because I'm giving him a position, I'm letting him do what he really passionately, enjoys doing. I mean, it's really his life, and so you're helping him survive. And everything. Thank you. I keep telling him. That's what I keep telling him.
Thank you,
I'm
Miriam.
kidding,
No, thank you.
but thank you so much.
Well,
Well,
there's a
Tanya
motion on the
last-
floor. Oh,
Last month asked me to continue for another 2 years and I have accepted.
Yeah.
and you did too, Bill.
All of our.
I did.
All the citizens.
Yeah.
Interested.
Yeah, so thank you,
Thank
those
you.
on the phone. Thank you.
Citizens.
Do I get to call for the second on the motion?
Did,
Who seconded?
I second, yeah.
Okay, motion all in favor to adjourn.
Aye.
Opposed, same sign. We are adjourned. Thank you. Brought some treats. Yes.